The NHS Digital Diabetes Prevention Service was first piloted around 2017 to 2018. Up to that time, the service had always been delivered face-to-face in groups in local communities, but the NHS wanted to try out whether a digital service was worth having. So essentially it was the same service as face-to-face, but delivered digitally. And clearly that might benefit some people. Some people might have a strong preference for not wanting to go to groups, for example. So for some people it might be more attractive.
We were really interested in exploring people's decision making around taking up and using the Digital Diabetes Prevention Programme. We hope by exploring the factors that influence people's decisions that we could then make recommendations about how the delivery and promotion of this service could be improved.
Well, we can identify people that are at increased risk of diabetes in primary care, and the programme aims to reduce the risk of those people then going on to develop type 2 diabetes. And there's three main things that those people that are identified as being at increased risk can do. They can adopt a healthier diet, exercise more, or lose some weight.
People didn't realise the seriousness of something like type 2 diabetes, and it can be a very serious condition, which can easily be helped with these lifestyle changes, which again, a lot of people didn't realise that, and myself included. And if your healthcare people don't tell you that, then you don't really know that there's things that you can do to help yourself.
So we interviewed people from a wide range of backgrounds, including different ethnicities, ages, genders, and we interviewed people who had decided to take up the programme, as well as those who had decided not to. And there are 4 providers of the digital programme, so we spoke to people who are using all 4 of the different interventions available. So there were several factors that we found that were important in decision making to take up the digital programme. People thought it was a really good way to deliver a service digitally. It was convenient, accessible and flexible, and it also sort of removed some of the barriers that people had concerns about with the face-to-face group delivery, such as travelling and having to engage in discussions with other people. There were also particular features of the digital interventions that people found really useful in motivating them and providing accountability to their lifestyle changes. So features that allowed them to track and monitor goals, and also the health coaches who had one-to-one conversations or had contact via messaging were really useful in supporting people, tailoring the interventions and making people feel motivated and accountable.
People like to visualise their goals. That helps them sort of think about what it is they need to do. People like to be able to track their progress. I think that's another thing that I've found through my work. And also I think it's good that people can see the impact that changes they're making to their lives are having on things like their blood sugar levels, for example, so see how what they're doing is actually having real changes to their health.
I think that certainly after the COVID lockdowns, when people had to do a lot more online and perhaps things, talking to their doctors with telephone interviews and so on, I think people are a lot more open to that now.
Findings showed that the people who attended the digital diabetes service did just as well as those on the face-to-face service. So it suggested to us that in terms of both weight loss and blood glucose, you can achieve just as good results if you go on the digital services as if you do on the face-to-face. However, we did find that some groups of people did better on one or other of those 2 services. So some people did better on face-to-face and some people did better on digital. And we also found that when people were offered a choice of services between digital and face-to-face, if they'd chosen to go on the digital service, then they did better compared to those who didn't have a choice.
It saves time for people. It's a lot easier for people who work, perhaps, because they don't have to take time out of their work. They can do it in the evenings. They don't have to have specific times when they can do it. For people like myself who's disabled, you don't have to go and find a parking place. You don't have to have specific travel and so on. It's a lot easier to do things at your home, and just it's a lot less energy sapping sometimes. Yeah, I mean, I find that I get very tired sometimes, and so the thought of actually having to go out somewhere and be part of the programme might put me off doing it perhaps, whereas if I could do it at home, then it's all to the good really. It's a lot easier.
So I think some people might struggle a bit with being in big groups. They might prefer just to work through things on their own. They might get a bit anxious in big groups. And other people might find that, the kind of group work just doesn't suit their learning style. They might be the type of person that just prefers to work through things in their own time.
So we're hoping to use these findings to make recommendations to the NHS, which will help them to improve the service, take up and delivery, and make it available to more people. So these include recommendations about more detailed discussions with people around what pre-diabetes is and how lifestyle changes that can be made by using the programme can be incorporated into people's lives to help reduce the risk of diabetes. So we also recommend perhaps trying to introduce a way for people to be able to check the progress that they are making or the impact that their changes are making on their risk of developing type 2 diabetes, to see how their diabetes risk is changing throughout the course of the programme might be motivational for people to carry on using the programme.
I think prevention is one thing that the NHS could do a bit better and do a bit more of. Type 2 diabetes especially costs the NHS a lot of money every year, and it also costs people a lot in terms of their quality of life. So I think that projects like DIPLOMA are really important to help us learn more about what we can do to encourage people to live healthier lives, reduce their risk of developing type 2 diabetes, and then the kind of impacts that will have will be, saving the NHS money and letting people lead healthier, longer lives.
I think it means for the NHS that they can confidently offer both the digital service and the face-to-face service. They're both likely to be effective for patients. And in fact, since this research has finished, the NHS decided to roll out the pilot digital service. So now what we've got running in England is a digital service and a face-to-face service running side by side in every area of the country.
It's really encouraging to see the findings from the research, and I think they can have a really big impact on type 2 diabetes and how many people go on to develop it. So I think it could have a huge impact all around on people, on the NHS, on families, on people's lives. So, yeah, really important. And I feel really proud to be a part of that, really.